Welcome. My name is Ajwa Chimiting of National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And I am here with Dr. Gatson. Of our 40 under 40 class of 2016, the inaugural class of the 40 under 40 minority health leaders at National Minority Quality Forum. And we're just so glad that you're here with us in 2025, here to welcome the new class of leaders. And we're just really interested in hearing from you, sort of, what is your perspective, especially in this environment? Coming here, what is your view as far as what this class should know?
Thank you. I'm Natosha Gaston. I am a neuro-oncologist and professor of medicine and neurology at Indiana University. And I'm also the founding president and CEO of Living Oncology. Thank you for that question. What I really want to impress upon this group is the power of networking and understanding health literacy. The difference between just simply educating a group of people and health literacy is education can tell you what is wrong with maybe your diet and the things that are happening in a disease. Health literacy empowers a group to use the tools to make a difference in their health and their health outcomes. So when we talk about health literacy and networking as a group, we should be focused on measuring those outcomes that prove that we've educated the patient and then empowered them with the tools to make a difference.
You know, you're touching on something that's very interesting right now, which is this concept of health management and empowering patients to perhaps have better adherence to the medications that they're taking or to improve their chances of better health outcomes. How do you think that that has evolved over the years? Do you think that patients feel more empowered or less?
Thank you for that, because what I do as the president of Living Oncology is designed to create spaces for patients to intersect with physicians and with scientists so that there's patient-facing opportunities for them to be involved in their healthcare. We know as physicians that when a patient walks into our office and asks for a particular technology that they have now found on Google or somewhere on the internet, they're challenging us to make sure that we stay on that same cutting edge. So patients are more empowered now, but we need to make spaces for them to interject their ideas and their values, their concerns with different technologies. Unfortunately, a lot of the clinical trials are designed to understand overall survival or to measure how long a person lives on a drug, when in actuality, patients care more about how well they live on this therapy,
right,
or how well they live through their journey, whatever disease site that we're talking about. So I empower patients to fight for that potential to live well and not so much to live long.
Let's talk about that. You know, how can we improve, I guess, understanding of clinical trials in underserved communities? What would you say you've learned through your practice of Living Oncology?
Yeah, thank you. The biggest thing for me is making sure that I sit down with patients and find out what it is about a particular therapy that motivates them to stay on it. And some of that has to do with the trust of their physician. But what is that line that they draw when they say, I'm no longer going to fight against the tumor and fight the cancer itself. I'm going to fight for quality of life. And when patients make that shift, physicians have to be ready to honor these patient values. The mistake that many physicians make is to believe that we save lives. We cannot save a life. What we can do is extend it with quality. And when you talk about extending quality survival, patients listen. Patients, I have a very high level of patient adherence to my plan because one, I understand their values first. And then I move into the evidence and trying to design care, but I design it around their values.
You know, we under the previous administration, they passed a mandate for diversity in clinical trials. There's some confusion now about, how we continue forward. What is the framework to actually achieve that diversity? What would you say is the missing ingredient that most pharmaceutical companies don't understand in either the clinical trial recruitment or the design of the clinical trial program itself?
Yeah, great question. And unfortunately, a lot of times the clinical trialists are separate from the patients. They're also separated from information such as Dr. Puckrin was talking about, this idea of having these databases, large databases that gather that information for us right here within the NMQF, having that information at their fingertips and being able to access that from a physician, a scientist, and a patient standpoint. Those things are missing. We're missing the knowledge as to where that data is stored and how to access that data. Once we have that, we need to break down and be willing to divide survivorship and understanding where the patients are being involved in making decisions about their care. We need to understand those divisions. Unfortunately, we don't make a lot of spaces for the scientists to engage the patient. Living Oncology makes for some of those spaces so that when clinical trials are being designed, they're being designed with the patient in mind.
Let's talk about patient values, because that really struck me. How do we address, say the elephant in the room, but what tends to be a staple of cultural beliefs, faith, especially when for particularly tough cancers, we're talking about potentially life or death, or we're talking about, how it impacts family, how it impacts their own understanding of why is this happening to me? How do you address that, or have you been able to address that with your program?
Yeah, thank you for that question too. Very powerful questions here. I'm very grateful. I deal with brain tumor, and the brain is the organ that basically captures the essence of being human, how we think, speak, emote, sense the world around us. And when those things are challenged, the person's values are now being put right up front. The person has to now start to decide, how am I going to manage this disease? When I talk to my patients, and I try to talk to them with their caregivers in the room and other important people that are part of their survival, their circle, I make sure that we start off with understanding their values and understanding if a patient wants to spend the last few days of their lives in their home setting, if they want to travel. I make sure that I design my treatment around those values.
Wow.
Unfortunately, a lot of patients get caught up in this loop of, I have to do what my family, I have to survive for my family. And they end up going through more of a struggle with the treatment. When I design treatment plans, I say that the treatment should not be worse than the disease.
Right.
If the disease is not causing you to be nauseous and sick and laying in bed for the entirety of the day, then the treatment should not do that.
Right.
And so if I start with the compassion and I start with understanding patient values, then I can communicate to them a plan that keeps those values in mind.
It's so powerful. So for our viewers, what questions could they ask, their oncologist in order to achieve better quality of life when they're facing their treatment choices? How do they ascertain what would be the right treatment for them if their oncologist isn't necessarily adopting your approach?
That's right. I think that patients can ask, the simple questions are, tell me about the side effects of this drug, or tell me about the most common things you've seen patients struggle with being on this therapy. Patients need to ask about alternatives. And another very powerful thing that patients can do is ask for a second opinion. As a physician, when my patients want a second opinion, that's an opportunity for me to either, one, learn a new way to do this, because that patient will come back to me with that opinion. Or 2, teach another physician my alternative, my way. Or 3, I'll agree with that other person, and that second opinion will have matched. When a patient asks for a second opinion, a good physician will say, right on. And allowing those patients to feel comfortable to be in front of the decision making and stand in that power.
That is amazing. Patients can teach physicians. That's a powerful message, but it's definitely core to this concept of shared decision making with your physician. I want to thank you so much for being with us, Dr. Gordon. You were amazing.
Thank you so much.